Hello, my name is Greg Egan. I'm a social worker registered with the Australian Association of Social Workers and a private practicing clinician. What I want to talk about today is what is CBT, or Cognitive Behaviour Therapy, because it's a common technique that's used to treat a lot of psychological disorders. And let's look at some of the common CBT techniques that are, in summary, that are used with this form of therapy. So let's get into it. So, cognitive behavioral therapy is a type of psychotherapy that focuses on changing negative thought patterns and behaviors that contribute to mental health problems, such as anxiety and depression. It is based on the idea that our thoughts, our feelings, and our behaviors are interconnected and influence each other. In CBT, the therapist works with the client to identify these negative thoughts and beliefs that are contributing to their mental health problems. The therapist then helps the client to challenge and reframe these thoughts, replacing them with more positive and realistic ones. CBT involves behavioural interventions, such as gradual exposure to feared situations or activities to help the client overcome anxiety and develop coping strategies. The therapist may also teach the client relaxation techniques or other skills to manage stress and anxiety. CBT is typically a short-term therapy that involves structured, goal-orientated approaches. The therapist and the client work together to identify specific goals and develop a treatment plan to achieve these goals. CBT is an effective treatment for a wide range of mental health problems, including anxiety disorder, including depression, post-traumatic stress disorder, PTSD. It is often used in a combination with medication or other forms of therapy to provide comprehensive treatment for various psychological disorders. And now let's look at some of the common behavioral therapy techniques that we use with CBT. Now, cognitive restructuring. This is a technique that involves identifying and challenging the negative thought patterns that contribute to our mental health problems. The therapist helps the client to identify cognitive distortions, such as the all or nothing thinking, black and white thinking, overgeneralization, and worst case scenario. The client then learns to replace the negative thoughts with more positive and realistic ones. Behavioral activation. This is a technique that involves identifying and increasing activities that bring pleasure and a sense of accomplishment. The therapist works with the client to create a list of activities that they enjoy and that are consistent with their values and goals. The client then gradually increases engagement in these activities to improve mood and overall motivation. Exposure therapy. This technique involves gradually exposing the client to the feared situations or objects in a safe and controlled environment. This helps the client overcome anxiety and develop coping strategies. Relaxation training. This technique involves teaching the client relaxation techniques, such as deep breathing, progressive muscle relaxation, guided imagery, meditation, etc., or breathing techniques, as well as many others. These techniques can help the client reduce stress and anxiety. Mindfulness meditation. This technique involves teaching the client to focus on the present moment and to observe their thoughts and their emotions without judgment. Mindfulness meditation can help the client develop self-awareness and emotional regulation skills. Social skills training. This technique involves teaching the client specific social skills, such as communication, assertiveness, problem solving. The client can then apply these skills in social situations to improve relationships and reduce social anxiety. And CBT techniques are tailored to the specific needs of the client and may be used in combination with other therapies. So that's just a quick summary of what CBT is and some of the techniques that we commonly use with it. Now, if you're interested, I'll be adding some links below. And there's a great Western Australian government website called the Centre for Clinical Intervention. and it's got a lot of great CBT tools on there. And Health Direct Government and Better Health Victoria, all of those sites have a lot further information on cognitive behavioural therapy and what it is if you want to do your own research. Anyway, thank you for listening. And if you'd like more videos like this, please hit like and subscribe as I continue to bring these types of vlogs. Thank you.